All right, we're going to be looking at chapter 21 and we're going to be focusing in on skin and eye diseases. So with the skin, guys, this is the body's first line of defense. It acts as a physical barrier in that it's a cutaneous membrane of closely packed cells, which creates a wall or barrier, making it hard for things to move in and out of that structure. We also see that it's going to be a dry membrane. The normal flora, the NF here is normal flora, produces acidic secretions, and also the top layer of the skin sheds off and is constantly replaced. So everywhere you go, you're leaving behind skin. We also see that there's sebum. Sebum is from your oil glands, perspiration, which is going to cleanse, but also produce a special enzyme called lysozyme, which is going to potentially break down bacterial cell walls. Both of these last two are going to accommodate the environment that your normal flora prefer. This is going to allow them to outcompete potential pathogens. We also see mucous membranes. Mucous membranes are going to be any covering of a natural opening in your body, like the going into your ear, your nose, your mouth, the anus, vagina, urethra. We also see the conjunctiva, which is the covering of the eye. These both still act as physical and chemical barriers as well. One example with the eyes is when you blink, you are spreading tears across the eye. The tears are not just there to keep your eye moist. It also helps cleanse the eye as well as producing the enzyme lysozyme. The normal microbiota is also known as your normal flora. This is mostly going to be gram-positive cocci and bacilli. So remember, cocci means they are spherical or round. Bacilli are the rod-shaped. Some examples of some microbiota where they can be found. In your nose, a lot of times there's Staphylococcus aureus. We also see on the skin, we can find Staphylococcus epidermidis, macrococci, diphtheroids, and Propionibacterium. These are going to be more resistant to drying out. The whole point is that they're in hyperosmotic conditions due to the salt content of your sweat, and so they have ways to overcome that hyperosmotic condition. So let's look at the skin bacterial infections, starting with Staphylococcus aureus. Now, Staphylococcus aureus is found in some areas of your body. However, if they gain access into new areas, we see that it can cause some things like folliculitis. Folliculitis, an example, would be pimples or styes, boils and abscesses, which are also known as furnicles, carbuncles, which is when the bacteria is going to invade neighboring tissues. We also have impetigo, which is pyoderma. This is also going to be seen, it can be caused by a strep infection. We also have scalding skin syndrome and toxic shock syndrome. These are toxin related, meaning that the toxins that are released by the bacteria are causing the signs and symptoms for the patient. Bacterial infections continued are going to be like Streptococcus pyogenes. This is going to be group A strep. They can cause impetigo. They also can cause erysipelas and necrotizing fasciitis, also known as flesh-eating disease. We then have Pseudomonas aeruginosa. This is going to be an issue sometimes for burn patients. It also can cause aureus externa, which is an external ear infection, also known as swimmer's ear. And then, of course, we have the Propionibacterium acnes. So let's look at Staphylococcus first. Remember, Staphylococcus gets its name because it forms clusters of these sphere-shaped structures. Remember, they are also, when they're gram-stained, they are gram-positive, like you can see here in the picture. They are going to have this cluster state if they are stained straight out of body fluids or broths. If they're grown on a plate, like you see here, we won't necessarily see the clusters. Now, with Staphylococcus, there are different species. So Staphylococcus aureus is going to have a golden or tannish color when it grows on the plate. Their colonies are going to be tannish. Staphylococcus epidermidis is going to have this whitish colonies. If you find these yellow colonies, this is micrococcus species. Now, a lot of times these are what we would consider healthcare associated infections. We see that patients get these a lot of times when they are in healthcare facilities as a kind of secondary infection to maybe what they came into, or if they had like a surgery, they gained access and made them sick. A lot of times these are what we would consider opportunistic, especially the Staphylococcus epidermidis. Those are found on your skin anyways, but if they gain access under the skin, it can cause infections. This is going to be be a simple break in the skin, just like an IV puncture. So how do we ID the different types of staph? Well, of course, we see that when we do the gram staining, we will see that it is gram positive and has the cockeye shape. We then would do the catalase test. Staph is going to be positive for catalase, which means that it's going to produce bubbles. Now, when we use this, we're going to use hydrogen peroxide, and this tells you that the enzyme catalase is present since bubbles are being produced as it breaks down the hydrogen peroxide. Now, so far, this just lets us know that we are dealing with a type of staph. How do we tell the difference between Staphylococcus aureus and other staph species like Staph epidermidis? Well, we would do another test. This is called the coagulase test. With the coagulase test, we are going to see if there's clotting present. Okay, where it says it's going to inhibit the fibrin clots. So you see the Staphylococcus aureus is going to be positive for the coagulase test. You can see the clot that's formed here in the tube, whereas other staph species are not going to be positive. They're going to be negative, where there's no clots formed in the tube. This would be the example with Staphylococcus epidermidis. So do you see how these tests allow us to be able to distinguish and rule out what we're looking at? Once we know it's a gram-positive cockeye, we then look to see if it's in clusters. We do the catalase test and so on. It can lead us to what kind of bacteria we're looking at. So which microbe has more invasive factors? In this case, it would be the Staphylococcus aureus, because when we see here, it's going to be positive for this coagulase test because it contains some of those more virulent factors that we talked about in the previous chapter. Here, Staph aureus infections are going to be seen in the skin. They can be mild to severe. Examples of this is folliculitis, which are the pimples or the sty. It can then progress into something that's a little more severe with boils and abscesses, and then finally into carbuncles. Now, this is going to be where larger areas are involved, which I'll show you a picture of in just a minute. We also see impetigo, but remember, impetigo can also be caused by a strep strand of bacteria. So guys, when we look here, here's folliculitis. Folliculitis are going to be pimples or styes. And so a lot of times if you've dealt with acne, it could be that the hair follicle gets infected with this Staph aureus, causing it to give a pustule that is present. If this happens in the hair follicle of your eyelashes, that's what we call a sty. A furnicle is where it's going to be a little more severe. This is a boil or abscess, and so it's going to be deeper in a larger area that's involved. And then a carbuncle is going to be even bigger because it's going to start invading neighboring tissues. It's an abscess that is larger than a boil, so it's going to be a larger area, and sometimes it can actually be hard, and again, it could be full of pus as well. When we look at impetigo, also known as pyoderma, this is a very highly contagious bacterial infection. We get it from direct contact. It spreads in children very quickly because a lot of times they're touching each other and things like that. They don't wash their hands as often. Now, in order to treat impetigo, we can use topicals, but impetigo is usually self-limiting. It's only going to be around for a certain amount of time and it will eventually go away. It does form these little crusties on the skin. It almost has like a honey yellow type color that forms like a crust, like the wound is weeping. This is caused by your body trying to fight off the bacteria. However, this is the part that as it's weeping, it can cause it to be very contagious if one person touches it and touches somebody else and so on at direct contact. That's a lot of times it can spread even within the patient by what we would call auto-inoculation, where we touch it on this side and we touch somewhere else and it starts to spread on our own body because of that idea of it being highly contagious. Now, keeping on with the Staph aureus infections, remember we talked about there were two that are toxin related. These are going to be the scalding skin syndrome as well as the toxic shock syndrome. With the scalding skin syndrome, this is where the skin starts to separate in its layers. It's called an exfoliation. It starts to peel off. And it's very painful in this process. Think about it like if you've got a sunburn, it starts to peel. However, this is the skin just being pulled off due to the toxin that's being released. We also have toxic shock syndrome. This can be life-threatening because it can ultimately cause the patient to go into kidney failure, which could result in death. This is normally a late stage. A lot of times it has a sunburn-like rash and blister that starts on the skin first, and then it progresses to a more systemic type of infection where the kidneys start to get involved. All right, so now let's briefly talk about the Streptococcus. With Streptococcus, this is shown on a blood auger. These guys will do hemolysis because they produce what we call hemolysins. They like the red blood cells, and so they'll break apart the red blood cells in order to digest different parts of it. So we see here the Streptococcus, the alpha is a partial hemolysis. This would be strep pneumoniae, you can see it here. It does cause some lysis of the red blood cells, but not a lot. A lot of times it starts to be like a greenish color on the agar. The beta is going to have complete hemolysis. So if you'll see on the plate, you can completely see through it here. This is your group A strep, which is the strep pyogenes. We also have group B strep that's part of this beta. We then have the gamma. Gamma does no hemolysis. It can still grow on this blood agar, but it does not actually use the red blood cells. These are actually Enterococcus. They used to be called the group D strep, but now they're known as Enterococcus. So the group that's really important here that we're going to focus in on with the skin is the beta group, and especially the group A strep. So Streptococcus and Enterococcus ID, how do we tell the difference? So now remember, this is still a gram-positive bacteria. It has the coccus shape. However, these guys form in chains instead of clusters. So when they're stained from body fluids or from broths, again, plates, they don't always show this morphology, we see that they are going to form chains. That's where the strepto comes from. Now we would do the catalase test. Now the catalase test comes back as negative. So this tells us that it's a streptococcus or an enterococcus versus a staph. Okay, and so because there's no bubbles, we would say this is a catalase negative test. This is going to allow us to be able to differentiate between strep group A, strep group B, Streptococcus pneumoniae, and also the enterococcus. So there's a variety of tests that could be used. And some of these tests will be discussed later in your lab. So here, the Streptococcus virulence factors, what are things that help the Streptococcus be able to invade? Well, they produce a variety of exotoxins and also exoenzymes. And recall from the previous chapters that we talked about, these are things that allow the bacteria to overcome your immune system for a time. Remember, there's the hydrogenase. This is going to digest the hyaluronic acid. There's the streptokinase, which helps dissolve clots. They do also will have capsule production, as well as the M protein, which helps them invade an area. And then the streptolysins, which helps them lyse the red blood cells. These are also going to be toxic to white blood cells, who are supposed to be fighting off the invader. So Streptococcus pyogenes is going to be your group A strep. This is going to cause things like impetigo, erysipelas, and necrotizing fasciitis. It is going to be sensitive to bacitracin. We can see that here with the antibiotic disc here. It is sensitive to bacitracin. Here we have two examples with pictures. Impetigo we already saw. It's not going to look different whether it's caused by staph or strep. We may have to treat it a little different based on the type of bacteria, but it's going to still present and look the same. When you look here, erysipelas can be local, but it can also be highly destructive as well. It can advance and it can move through the areas. Necrotizing fasciitis is going to be where the immune response actually contributes to a lot of the damage, but it is known as flesh-eating disease, and we're going to see that a lot of the tissue starts to be very necrotic, and we can lose that tissue very, very quickly within hours. When I worked in a hospital in Portales, we actually had a patient who had necrotizing fasciitis. We ended up having to airlift him out. He spent about 6 months in the hospital where they're trying to get it under control, and it did result in some major skin grafts due to all the tissue that he did lose in that process. And so it's a very, it can advance and it can progress very, very quickly. The next group are the Pseudomonas. The Pseudomonas are opportunistic infections. They're relatively resistant to antibiotics, and they do reside in a lot of water habitats. One example are physical therapy whirlpools, and again, this is really important, why it's really important to clean those very well. Again, this is why it can be seen in burn patients, and because it is resistant to a lot of antibiotics, this is where we would use the silver sulfadiazine, because this silver would help us keep this under control. We also see that this is going to be one of those that causes the odious externa, or the swimmer's ear. Now, the Pseudomonas, guys, these are gram-negative bacilli, so this puts them into the different group. If it's not gram-positive, it's gram-negative, we see that it would be here. And again, it has a bacillus shape where it's the rod. These guys can also then, if we take that, do another test. It's called the oxidase test. Remember, oxidase is going to be testing for a particular enzyme of whether or not it does aerobic respiration. And so we would take a little bit of the filter paper, we would put some of the bacteria on it, and then we would drop the oxidase chemical. This is going to either be oxidase negative or oxidase positive. Okay, in this case, it would be positive and it would turn purple if it is a Pseudomonas. Also, the Pseudomonas do produce what we call, it produces Piocyan. It's going to be this greenish color that's found here on the plate. This is going to be used, pigment that it gives off is going to have antibiotic and antifungal agents, which helps make it where it is resistant to a lot of antibiotics. One thing to note too is that when this is grown on a plate and you open it up, a lot of times it's going to smell like corn tortillas. Propionibacterium acnes is going to be what causes a lot of times our acne. This could be a mild acne to a very severe. These guys are obligate anaerobes, meaning they've got to gain access into an area where oxygen is not present, so they like deep into the dermis, into the hair follicles. These are going to be gram positive, the purple color, but they are what we call paleomorphic bacillus. They are bacillus in structure. Treatments is going to be over-the-counter topicals. This is going to be a lot of times like your Clearasil, anything like that you use a lot of times to cleanse the face or the body. So the clear light and the thermoclear systems are going to use a lot of times a high intensity light. This light helps with a little bit of the heat that will promote healing of the tissues, but also prevent outbreaks. We also have the antibiotics. With these antibiotics, this is going to be the erythromycin, the erythromycin, as well as clindamycin, another type of antibiotic. And then we have Accutane, which also can be used. Accutane can be what we call teratogenic. This means that it could cause damage to the fetus if a woman is pregnant, and so it wouldn't be prescribed or used a lot of times by women who are pregnant or could become pregnant, because it can potentially cause birth defects in the fetus. Now let's switch gears a little bit and look at some of the viral diseases that are related to the skin. So these are going to include things like warts. Warts are caused by the papillomavirus. We also have smallpox, which is the poxvirus or variola. We also have chickenpox. Chickenpox is caused by a type of herpes virus, varicella. Shingles, which is another herpes virus, which the term is zoster. Cold sores, which is herpes simplex type 1. Measles, German measles, and Roselia, which is a herpes virus 6. All right, so let's start with warts here. Warts are caused by the papillomavirus. They are typically benign growths, meaning they're not typically cancerous, but they could progress that way. These guys are transmitted by direct contact. So when we look here at warts, they can be found in lots of areas. You can see them here on the hands, the feet. There's even the genital warts, which we'll actually discuss a little later when we talk about the urogenital infections. Treatment for warts is the cryotherapy, which is the cold, where we got to talk about freezing them off. They may also use burning them off with acid. And then there's also some topicals. The topicals are some induce interferon production, and interferons are something that are produced by your cells to help prevent them from being infected with a virus. Now, there are over 50 different types of papillomaviruses that are present. And guys, when we look at warts, they are limiting. They will eventually go away on their own, but it could take years for that to happen. All right, so now something we need to look at before we actually get into a lot of these other viral diseases of the skin is we need to be able to tell the difference between a macular rash versus a vesicular or pustular rash. So when we look at a macular rash, this means it's going to have a lot of red rash spots to it, but they're flattened. They're not raised in any way. These are discussed on page 584, and this includes your measles, rubella, fifth disease, roselia. We also see that there are the fluid-filled vesicles. These are going to be raised lesions that contain pus. This is why they're called vesicular or pustular rashes. These are discussed on page 586, and this includes smallpox, chickenpox, shingles, and herpes simplex. So here is a chart that shows you the overview of the vesicular and pustular rashes. So this is going to be where we can see chickenpox and shingles, as well as smallpox, monkeypox, and herpes simplex. So if you look at smallpox, monkeypox, and chickenpox, all of these are going to gain entry into you through your respiratory tract, which means these are going to be found in like aerosols where somebody's coughed or sneezed and it's in the air, or by direct contact that can occur when we talk about the monkeypox, where you're going to come into direct contact with that animal or small mammals who are carrying it. Chickenpox and shingles are very similar. Now, shingles, on the other hand, is going to be endogenous, meaning the infection of the peripheral nervous system. So it's going to manifest on the skin. However, it travels down the peripheral nervous system to do this. It is a reoccurrence or latent chickenpox infection. So it is related to chickenpox, but you have had to have had chickenpox or at least the chickenpox vaccine to have shingles. Now, one thing for treatment when we're looking at the chickenpox and shingles, one way to treat that is with a certain type of antiviral, which is called acyclovir. We also see with chickenpox and shingles, there are preventative vaccines that can be taken as well. All right, so let's talk about smallpox. So let's look at smallpox first, also known as the Poxvirus. This is going to create smallpox lesions. These will normally become pustular after about 10 days. This disease is considered eradicated, and the reason is the last natural case of smallpox took place in 1977 in Somalia. Okay, there hasn't been any natural cases of smallpox since then. There have been some cases where people have been exposed in a lab accidentally and they got smallpox, but there hasn't been any natural cases. When we look here, there's no animal host reserve, and so being able to eradicate it in humans has helped us be able to control it. This was actually the first disease which immunity was artificially acquired through a vaccine. Genera developed the vaccine that provided artificial immunity. We also see that this smallpox vaccine also protects against monkeypox. This vaccine, though, does cause a scar, so individuals who have been vaccinated will have this scar. However, we stopped routinely vaccinating individuals in the 1970s since we were able to pretty much eradicate the disease. Now, there are some bioterrorism concerns with this because individuals like us that have not had this vaccination, we have not gotten smallpox because other people have had the vaccination and it's been removed from our kind of ecosystem in a sense. However, if it was ever reintroduced back into the population, okay, from another lab, it could potentially cause major issues, and we would need this for vaccination. So because of this, smallpox has not been destroyed. We have this virus hidden away. In the case for the United States, it's found at the CDC at Atlanta in probably high security areas for protection, but we don't want to get rid of it because we're afraid that it could be used by another country to attack us, and this is where the bioterrorism comes in. We also know that Russia has the smallpox on file as well. This brings us then to chickenpox. Chickenpox is a herpes virus, a varicella, and this is a childhood disease. When I was a kid, the way that we got vaccinated against chickenpox was when somebody had chickenpox down the street, you'd go play with them. And when you go play with them, then you 2 weeks later probably had chickenpox, and then you gave it to your siblings and things like that. That's actually how it happened at my house. I was exposed at school. I brought it home. I got the chickenpox. Then my brother, just younger than me, got him, and then my youngest brother got it about 2 weeks later. All right, and so that's how it used to be passed, and that's how you got your immunity, because you only normally get chickenpox one time. However, nowadays most kids don't get chickenpox due to the vaccine that is available. Shingles, on the other hand, is also a herpes zoster virus, and it's a latent infection, meaning that when the chickenpox virus has been overcome, it retreats and hides in your cerebral spinal fluid in your spine. Okay, it will actually hide in what we call some of these peripheral nerves, the dorsal root ganglia, the back root on the spinal cord. It will remain dormant there until it's been triggered, and a lot of times it gets triggered by stress. Some sort of stress triggers the release of this virus. Once it's been triggered, it travels down the peripheral nerves to the sensory nerves on the skin. A person can give chickenpox to somebody without immunity, though. If somebody has shingles, they could pass chickenpox on to somebody who has not been exposed before. There is a vaccine available. It became available in 1995, and a booster is recommended at age 60 because your chances of getting the shingles increases. Now, one reason it does stay latent is once it gains access into the nerves itself, your immune system can't get rid of it. Okay, your immune cells cannot get into the nerves without damaging it, and so it's one way for it to retreat and hide from your immune system. However, when it comes back out, your immune system can begin to fight it again until it retreats back into that nerve ganglia. The next one I want to talk about are cold sores, also known as fever blisters. This is caused by herpes simplex 1, and believe it or not, 90% of the U.S. population is infected with herpes simplex 1. Now, this should not be confused with canker sores. Canker sores are different. These remain dormant in your trigeminal nerve. Now, your trigeminal nerve is a cranial nerve that's found in your head, and it's called the trigeminal because it has 3 branches to it. Okay, so it has a branch to your forehead, a branch to your maxilla, this area of your top lip, and a branch down here to your mandible, this lower area. And this is why, though, it can gain access, because if we look here at the trigeminal, it can gain access into this mouth region. Now, a lot of times here, this is going to be triggered by sunlight, UV light, stress, and even certain hormones that are released can trigger your body to produce these sores. Now, these sores are going to be due to the fact that the virus starts to replicate. Herpes encephalitis is a rare complication of a herpes simplex 1 infection. It has a very high fatality rate, but survivors typically have serious neurological damage. And the reason, guys, is it could progress to this encephalitis is it has a connection to your brain when it's sitting here in this trigeminal nerve. It's not very often that this does progress to that point, but it could potentially cause some major issues. So guys, when we're looking at the fever blisters are going to be found on your lips and your mouth, whereas canker sores are found on your tongue, your cheek, or inside of your mouth. All right, so this covers most of our pustular type of rashes. Now let's look at the macular rashes. With the macular rashes, this is going to be like your measles, your rubella, fifth disease, roselia. We see that these are going to gain access through the portal of entry of your respiratory system, and they are going to be transmitted through aerosols, okay, being able to be transmitted through the aerosol. We also see for measles and rubella, there's really no treatment that can be out there, but there is a vaccine to help prevent you from getting those diseases. So the vaccine that's available is called the MMR vaccine. This is going to be for measles, mumps, and rubella. All right, so if we take a look here, this is going to show you the difference between measles, German measles, known as rubella, and roselia, or herpes virus 6. So let's look first at the measles rubiola. This is extremely contagious and it can be a dangerous infection. We can shed the virus prior to the actual outbreak. So the person could actually be infecting other individuals before they even know that they have the measles. Herd immunity is difficult to attain when this does occur because of the fact that it is infectious before symptoms arise. It is considered a childhood disease. The vaccine is given at 1 year of age. We see that it has a limited protection that's provided by maternal antibodies. So up until that 1 year point, we see that the mother can produce at least some limited protection. The rash first appears on the face and then starts to spread to the trunk and the extremities. All right, so now let's look at the German measles or rubella. This rash resembles measles, however, it's a milder case. It's associated with birth defects, though, where the mother is exposed while she's pregnant, and it can cause what we call congenital rubella syndrome. This could lead to deafness, cataracts, heart defects, and mental retardation in the baby. It's important to determine if pregnant women have rubella antibodies, okay, because we want to prevent these potential issues we want to prevent these issues for the unborn child, if at all possible. If the mother does not have those antibodies, then we need to make sure, then we would advise them to stay away from individuals with the German measles, or maybe even do a vaccination for them. But it's a milder form. Roselia is a herpes virus 6. It is mild and it is actually very common. It causes a body rash, but it has a high fever that lasts for a couple of days. Now this is something that is different because with the other types of measles, we don't see that there's necessarily a high sustained fever. A lot of times we would see more of a low grade fever that breaks pretty often. In this case, it does have a high fever and it does last for several days. However, you do have good immunity after the fact. That is what we would consider natural immunity, because now your body will recognize it if you were exposed the next time. All right, so now we want to look at fungal diseases of the skin. So when we're looking at fungal diseases of the skin, a lot of times these are going to be called cutaneous mycoses, or what we call dermatophytes, because they are going to be a type of fungal infection on the skin. These are also known as Tiness or ringworm. So we have Tinea capitis, which is found on the scalp, Tinea crurus, which is jock itch, Tinea pedis, which is athlete's foot, and Tinea ingumeum, which is for the nails. But these are all going to be a type of fungal infection just based on different locations. We also see Candidiasis infections, which are caused by Candida albicans. This is also known as thrush or oral thrush. So dermatophytes are going to be our tinnias or ringworms that we see here. We can see that the scalp ringworm or the capitis is going to be found on the head. We see here the jock itch that's located in the groin area. We also see athlete's foot, which is found on the foot, and then on the nails. Now, one thing to note when we look at the skin, it causes the skin to be kind of crusty, breaks, have soreness, skin starts to peel off, and in the nails, it causes the nails to start to get thick and yellow, and a lot of times the fungus is underneath the actual nails. A lot of times these are going to be treated topically with a type of cream, except for when we especially look at the nail infection, it may have to also be treated orally. Depending on how advanced this infection is, you may have to go to an oral treatment to allow it to be delivered systemically through the blood. One way that we can diagnose these fungal infections is through skin scrapings. What we can do is we can take a scraping of the skin and we put what we call KOH on it. This is potassium hydroxide. This potassium hydroxide dissolves away the skin and it leaves behind the fungus. The fungus then can be stained and we can look at it under the microscope to know what kind of fungus we are then dealing with. The oral Candidiasis is what we would call thrush. Thrush is actually very common in children because in kids, they tend to explore the world by putting stuff in their mouth, and so a lot of times this fungus can gain access into the mouth and causing a thrush infection. So it is very common in toddlers or children. We also see that it is a common opportunistic infection in patients who have an immunocompromised state, especially those who have HIV or AIDS. We see that they have more thrush infections than the normal individual. This a lot of times occurs when the normal flora is inhibited. This can also happen a lot of times if somebody is on antibiotic treatments where their normal flora is taken out, where it gives the fungus a chance to thrive, as well as again with the immunocompromised individuals. Now we're going to look at the skin parasite infestations. So these are going to deal around or revolve around arthropods. These are going to be things like your skin mites, also known as scabies, or hair lice, known as crabs. So with skin mites, they are going to burrow underneath the skin. When they burrow under the skin, they are going to create a lot of times like red lines as they burrow through the skin. And this is where they're going to lay their eggs. We also see there with hair lice, also known as crabs, they like to be on the scalp or eyelashes or even in the pubic region. They are adapted for the different parts of the body. They've actually done experiments with this. I would not volunteer for this, but they take an individual, have them lay down, and they take these 3 types of lice: head lice, body lice, and what we call pubis lice. They place it on the individual in like the stomach area, and they will migrate to the area that they prefer. Okay, so they have certain adaptations for certain areas of the body. Now when we look at this, they will lay their eggs right on the tips of the hair follicles on the scalp. These are called the nits, where the eggs then will hatch and they have a food source with your scalp and potentially then can move on to other individuals. It can be highly contagious. All right, these hopefully, as we're talking about, didn't cause you to itch, because a lot of times that is what happens because they're just really annoying in the sense that they cause itchiness. These are both though very treatable. Okay, they can be treated with medications and even with topical types of treatments with hair washing and skin washing. The thing with the skin mites is that it can be located in the beds and things like that, so bedding and beds may need to be treated as well. And with the hair lice, the same thing, but they cannot survive very long off of an individual. So we want to focus in on the bacterial infections of the eye that we call conjunctivitis. We have Hemolysis influenzae. This is also known as pink eye. This is the bacterial form of pink eye, where the eye appears pink and it may weep, and it is very highly contagious. We then have Neisseria gonorrhoeae. This causes a neonatal gonorrheal ophthalma. So this is one reason why we put the slab on the baby's eyes when they're born, to help protect them from potential eye infections here. And then of course chlamydia. Trichoma, this can actually lead to blindness if it is left untreated. So these are just some different infections that can occur with the eye that are caused by different bacteria. So that kind of sums up, I know it's a lot of information kind of in a short period, where we just briefly talked about the different types of infections that deal with the skin, but we're going to do this for each of the different body systems that are located in your book. All right, so if you have any questions or concerns, please let us know.